In this video, I'm talking about how far you should be willing to travel to receive hearing treatment from an excellent hearing care professional. Coming up. Hi guys, Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona. And on this channel, I cover a bunch of hearing-related information to help make you a better informed consumer. So if you're into that, make sure you hit that subscribe button. And don't forget to click the bell to receive a notification every time I post a new video. Every once in a while, I get a patient who flies across the country to come see me in my clinic because they know exactly the quality of care that we strive to provide. After all, it is very difficult for you to identify whether or not a hearing care professional is going to be following best practices and utilizing a person-centered care approach to hearing care delivery. However, I often discourage patients from flying across the country to come see me in my clinic because there are hearing care professionals who are as good or better than I am, much closer to home, and they believe in the same things that I do when it comes to the quality of patient care that we strive to provide in my clinic. Yet, not everybody has access to an excellent hearing care professional within a 10-minute drive of their home. So the question becomes, how far should you be willing to travel in order to get what you actually pay for when it comes to receiving hearing treatment? And the answer really depends on how important it is for you to hear your best. Unfortunately, not that many hearing care professionals are committed to following best practices when testing you, selecting your hearing aids, fitting your hearing aids, programming your hearing aids, and providing you with follow-up care. This often results in subpar hearing aid performance, which leaves you wondering whether or not you're actually getting what you're paying for. Not to mention, if your hearing care professional does not follow a person-centered care approach to hearing care delivery, then it is likely that your experience will not be a positive one, because it will feel like they are just trying to sell you hearing aids rather than actually treating your hearing loss. Now, for some individuals, the time and money that it takes to fly across the country to receive hearing treatment is totally worth it. But for other individuals, it's not even an option. But in some cases, if you want the peace of mind that you're actually going to achieve your maximum hearing potential, then you may actually have to travel at least a few hours to get it. Consider this. In order to receive a proper hearing evaluation and hearing aid fitting, it's going to require at least 2 in-office visits. With today's hearing aid remote programming capabilities, you will likely be able to receive additional follow-up visits from your hearing care professional in the comfort of your own home through teleaudiology that will connect directly to your tablet or your smartphone. However, you will also likely need at least 1 follow-up visit in clinic with your hearing care professional over the course of each year. So in reality, in order to maximize your performance with hearing aids, it's going to require anywhere between 3 and 4 visits in your first year and at least 1 visit per year afterwards. In the grand scheme of things, if an excellent hearing care professional was within 3 hours of your home and you had to go see them 3 to 4 times within the first year, then you're going to be committing about 18 to 24 hours of drive time to go and see them. That being said, there are over 8,000 hours in a given year, so this is a tiny fraction of your time over the course of the first year. Now, this is your time commitment just in the first year. Everything after the first year, for like your second, third, fourth, and fifth years, you're only going to be going in to see them maybe 1 or 2 times in a given year. Every other visit you're likely going to be able to do remotely anyway. Considering that this small time commitment would result in tens of thousands of hours worth of benefit for you from a hearing perspective, it really seems like it's a no-brainer that you should be willing to travel for excellent care. Okay, so we've established that it is definitely worth it to drive several hours to go and see an excellent hearing care professional. But what if you don't know where an excellent hearing care professional is? It doesn't really help you if you're willing to travel, but you have no idea who to travel to. So if you're not sure about where to go to find one of these excellent hearing care professionals, I highly recommend that you check out my website, drcliffaud.com, and click on the Find a Provider tab, which will take you to a locator map to help you find the closest Dr. Cliff approved provider near you. Each provider on my website is committed to following best practices and acting in your best interest, so you know that traveling to see them will be worth it. While I cannot necessarily make the decision for you on how far you should be willing to travel to receive excellent audiologic care, I do believe that you should be willing to travel a significant distance in order to make sure that your treatment is done the right way. Because if you choose to just go to any random Joe Schmo hearing care provider just because they're local to you, you could be setting yourself up for failure rather than success with hearing treatment. That's it for this video. If you have any questions, leave them in the comment section below. If you like the video, please share it. And if you want to see other videos just like this one, go ahead and hit that subscribe button. Also, feel free to check out my website, drcliffaud.com.